Alright, Grand Test 169 Psychiatry question. 8 questions are there in this paper as per our pattern. 2 questions are on drugs and 6 questions are on clinical cases. So let's start with the first question. Pseudo parkinsonism is most commonly seen in elderly females. If you have attended my last GT discussion, in that also I said most common overall is akathisia, most common elderly female pseudo parkinsonism. Okay, pseudo parkinsonism. It's a repeat question. Antipsychotic least likely to cause prolactin elevation. Least likely is aripiprazole. Okay, least likely is aripiprazole. If they ask most likely, then among typical most likely is haloperidol. Among atypical most likely is risperidone. Least likely because aripiprazole is itself a dopaminergic agonist. So it does not cause that much of dopaminergic blockade like others neuroleptics to cause prolactin elevation. Next question. See, clinical question. A middle-aged man presented with pain in back, lack of interest in recreational activity, low mood, lethargy, decreased sleep, appetite, no history of delusion, hallucination, hemogram, liver function, everything normal. Diagnosis is depression, decreased sleep, decreased appetite, low mood. Treatment is SSRI, and we have only one SSRI here, certainly. Pretty simple question. Next. Fear of leaving home, fear of traveling alone, fear of being in a crowd. Marked anxiety with palpitation and sweating if he is going to that places. Fear of leaving home, fear of traveling alone, fear of being in a crowd. These are the symptoms of agoraphobia. Fear of crowded places, open places, marketplaces. Agoraphobia. Increased alcohol consumption, sexual indulgence, irritability, lack of sleep, not feeling fatigue on prolonged period of activity. So it's not the lack of sleep, it is excessive activity, no fatigue despite overactivity. This is mania. Classical description of a case of mania. I mentioned in the last GT video also that I am including the classical description of the diseases so that you understand if this type of disease comes, this is the answer. This type of disease comes, this is the answer. History of episodes of altered sensorium, involuntary movement, memory deficit and headaches since the last 6 months. 4 episodes occur during the day and 2 during the sleep. Altered sensorium, involuntary movement and memory deficit can be seen in anything. In hysteria also, but 2 episodes during sleep, night episodes present makes the diagnosis of epilepsy. Pseudo seizure can occur in day, never occur in night. So it is epilepsy only because of episodes during sleep. A 4-year and 11-month-old boy is all the time so restless, rest of the class, unable to concentrate, hardly ever in his seat, roams around in the hall, difficulty in playing quietly, can't sit, can't concentrate, hyperactivity, attention deficit. Answer is ADHD. Classical description of ADHD in this case. A 3-year-old girl, normal development milestone except delay in speech, difficulty in communication, relating to others, does not make friend but plays with herself, self-play, less communication, less relation with others. Classical description of a case of autism. Classical description of a case of autism. That's all about this paper. If you have any queries, you can get back to me. Thank you.